Welcome back. Our Best Me in 23 series continues now with information on alternative methods to treat depression entering the medical community's mainstream. Joining us is author, psychiatrist, and psychopharmacologist, Dr. Julie Holland. Welcome, doctor. Thanks for coming.
Thanks for having me.
So many questions.
Yes, I have lots of questions. This is an interesting topic. There are plenty of information, things online about psychedelics, but what's about the resurgence? What brought this about? And how long has it been going on?
It's definitely trending, right? I mean, there's just a New York Times article a couple days ago. It's very popular. And really, the question is whether you should be taking it seriously or not, right? Not knowing how seriously to take these things. So, I guess, you know, when we think about psychedelics, we might think about the 60s and the hippies, and then maybe we want to discount that. But the truth is that the hippies were right about quite a few things. The whole anti-inflammatory idea of yoga and meditation, or fermented foods, kombucha, things like that, those were all the hippies' ideas, and they were actually absolutely right. Those things are better for your physical and mental health. So with psychedelics, there's been about at least 20 years of pretty serious, rigorous, double-blind, placebo-controlled clinical trials looking at using psychedelics to treat depression, anxiety, post-traumatic stress disorder. Turns out there's really a lot of convincing data there.
So question, at what point is this a path someone should consider? Because you have therapy, you have breathing technique, there's all those sorts of things. At what point should you look at this under the guidance of a doctor?
Well, if the currently accepted treatments aren't really working for you, if you've tried antidepressants, if you tried psychotherapy, if you've tried psychotherapy with antidepressants, maybe you've tried several meds, if those things aren't working for you, you can start to look at alternative therapies and see what else might be appropriate. And these are considered breakthrough therapies. The Food and Drug Administration has designated psilocybin and MDMA as breakthrough therapies for psychiatric treatments for depression.
And what other alternatives are there if you don't want to use any kind of drugs?
Well, one thing people really overlook is phototherapy, which is actually using light therapy to treat depression. And that works very well for seasonal depressions, sort of like the winter blues that people get.
Oh, like they have more sunlight and everything?
Yeah, and vitamin D can be very helpful, but also just good psychotherapy, whether it's individual therapy or with your family or group therapy. All those things can help if you don't want to take medicines or you don't want to try these alternative therapies.
And how do the alternative therapies actually work when you compare them to other medical prescriptions?
Yeah, I mean, it's very different, right? With the antidepressants, you're sort of treating the symptoms, you're not really treating the cause. And with psychedelic-assisted therapy, you're really getting to root causes. You're looking at trauma, you're processing trauma. You're also maybe finding more meaning in your life. If you're having existential despair, I think the psychedelics can really be meaning makers. And then you have this issue of neuroplasticity, right? Which is the brain being sort of more plastic, more flexible. I mean, a lot of depression and anxiety or OCD, it's about this sort of rigidity, this cognitive rigidity that you're convinced that this is the way it is, you know, or even with addiction, you know, if I have this drink, I'm going to feel better, or with anorexia, like I can never be thin enough. You're rigid in your thinking. And the psychedelics introduce a sort of cognitive flexibility. You
they
know,
loosen you up a little.
What if I'm wrong? But they also introduce that flexibility really in the brain. And people talk about neuroplasticity in terms of like rewiring the circuitry. You know, it's not exactly that, but it's a good metaphor that you can sort of do some end arounds and change the way the brain works and the way your thinking works. It changes your perceptions, your cognitions. Now, this is a short-term session that happens with a therapist usually. And there's a lot of preparation before and there's a lot of integration after. So this is not something you do as a take-home. It's very supervised.
All right, let's get a break. We'll come back more with Dr. Julie Holland right after this.
We're back with psychiatrist Dr. Julie Holland. Now, in terms of psychedelics, what are the potential options for patients seeking different therapies, and how long-lasting are these procedures?
Well, let's start with what's currently legal versus what is going to be FDA approved. So what's currently legal now in many states in our country is cannabis. Either legal for medical use or just for recreational use.
I smelled that in Times Square.
Yes.
Actually, I knew.
Well, just here in New York City, now we finally have legal cannabis instead of just medical cannabis. So it's important to remember that cannabis is sort of like a minor psychedelic. You could call it the people's psychedelic. It's very more available. You don't necessarily need medical supervision. And it can do some of the things that psychedelics do in terms of neuroplasticity and in terms of sort of meaning making. Then next we have ketamine, which isn't officially a psychedelic. It's actually an anesthetic. But it has psychedelic effects, especially in terms of neuroplasticity. Ketamine is completely legal, FDA approved for treating depression. And what's great about ketamine, too, is you don't have to stop your antidepressants. If you're on antidepressants and you're getting some effect, you can layer the ketamine treatments on top. So that's great, because some of the other psychedelics, you have to stop your psychiatric medicines. And as we know in psychiatry, getting off your meds can be really difficult.
Right.
So, and then you have psilocybin. So psilocybin is not yet FDA approved, but it will be for treating depression. And here, again, it's psilocybin-assisted therapy, right? It's not like a take-home therapy where you just go trip. You're working with therapists, you're working with a psychiatrist. They're screening you to make sure you're appropriate. Right now, we don't really allow people into clinical research if they have a history of bipolar disorder or schizophrenia, or even if they have relatives with this history of psychosis. So we're being very cautious. So you're properly screened. The psilocybin-assisted therapy happens once or twice, and then there's all this therapy on the other side, which is called integration, to help you sort of maybe walk the talk. You know, maybe you figured out some things during your psilocybin experience, but now you need to actually integrate them into your lives.
So we hear the term microdosing. What does that mean?
Yeah. So microdosing is taking about a tenth of a big dose or a macro dose, and you take that tenth of a dose, maybe 1 day on, 2 days off, or 1 day on, 3 days off. There's also a different protocol where you take the microdose 5 days on and then have 2 days off. You can't take a microdose every single day because you would get tolerant to it. So you do this program of every third or fourth day, or 5 and 2, 5 on, 2 off. You do that cycle for maybe a few weeks or even a couple of months, and then you check in and see how you're doing. It's not immediate, but it is something that people are doing without a lot of medical supervision. It is one of the things that can be added on to your psychiatric medicines. A lot of people microdose to get off their psych meds. They do a slow taper while they're microdosing. Some people use it to help with concentration or focus or creativity. It can help you get into a flow state.
So after you do that one round of sessions, how long does this work? So I've done the psychedelics or whatever.
Yeah.
Do I come back every 6 months, once a year?
That is a great question, because it's really different. Like with ketamine, it seems like people might get a pretty robust response, but sometimes it fades over a few months and you have to come in for boosters. Some people get boosters every month, every 2 months. It seems like with ketamine that you're not like, you know, a few sessions and then you're off and running for most people. But with psilocybin, it really is 1 or 2 sessions and you've gotten a marked decrease in your depression symptoms.
Wow.
That can last. So far, the studies are going out 1 year, that people are still holding on to the benefits that they got from the session.
Very informative. This studio has never been so quiet. Thank you for all the information. A reminder to everyone, please consult your doctors if you're interested in these treatments. They are done under medical supervision. Thank you, Dr. Julie. Pick up a copy of her book, Good Chemistry, The Science of Connection from the Soul to Psychedelics, where books are sold. Appreciate you being here.